Hi, my name is Wendy Ungar, and I'm a researcher at the Hospital for Sick Children in Toronto. In this module, I'll discuss access to prescription drugs for Canadian children. In Canada, we often talk about our healthcare system as if it's a single system, but actually we have not one, but 13 different systems, one for each province and territory. Although each province does a good job of providing benefits for hospital care and physician services, few provinces provide comprehensive drug plans for all of their residents. Most Canadian children, about 85 to 90%, have access to prescription drugs through a private insurance plan, usually through their parent's employer. The rest rely on some sort of public plan or have to pay for medications completely out of pocket. There's a surprising amount of variation across the provinces and territories with regard to public drug plan coverage for children. All the provinces provide drug benefits for families on social assistance or who receive welfare. New Brunswick, Quebec, Alberta, and Nunavut also provide drug benefits for any residents who don't have a private plan, regardless of their income. Manitoba and BC do this too, but their plans include some costs that are linked to family income. Many of the provinces have some sort of catastrophic drug plan for families with very high drug costs, but there are out-of-pocket costs with these plans that are linked to income that can be very high. Some provinces have special programs for children of low-income families, while other provinces have special programs to cover the drug costs for specific diseases, such as cystic fibrosis. Even though some provinces might offer similar plans, they will still charge co-payments or deductibles when drugs are purchased. A co-payment is typically a percent of the total prescription drug cost and ranges between 10 to 25%. A deductible is an amount, for example, $100, that has to be paid out of pocket before drugs will be covered by the plan. There have been several studies that have shown that high co-payments act as a deterrent to drug use. Our research has shown that it's not the amount of the co-payment per se, but the percent of household income consumed by drug co-payments that affects medication use. We found that for every 1% of household income that would be used up by co-payments for asthma drugs for children, there was a 14% increase in the risk of a serious asthma attack requiring a visit to the hospital. When drugs are expensive, you can see that co-payments can sometimes amount to a substantial cost to families. For this reason, some provinces keep the co-payments low, while others, such as Quebec, waive deductibles and co-payments entirely for any medications for children. There are some drugs, such as biologic drugs, that are so expensive that the co-payments alone will be very costly to families. These drugs are difficult to afford for families with no insurance. On this slide, you can see that the public drug plan coverage across the country for several very expensive medications that some children need. Enbrel, etanercept, is a biologic drug used for juvenile idiopathic arthritis, as well as for other severe inflammatory disorders in children. This drug costs about $375 per week, or close to $20,000 per year. It's interesting to note that none of the provinces or territories in Canada cover Enbrel as a general benefit. Families must request the drug through a special authorization mechanism, which can delay access to the drug by several weeks. Other expensive drugs, such as Neupogen and Zofran, are covered in only a small number of provinces or territories. Tazocin, an antibiotic which is used in children who have had bad reactions to other antibiotics, is not covered at all in most provinces, covered only with special authorization in 2 provinces, and provided as a general benefit in 2 others. So it's clear, despite the same evidence of safety, efficacy, and cost effectiveness, provinces and territories can vary greatly with respect to which drugs they cover for children. When some children have affordable access to the medications they need, but children in other provinces do not, or children in the same province who are covered by a different type of plan do not, that creates inequity. To summarize, there are several impediments to accessing needed prescription medications for children. These include not having a drug plan, not living in a province with a public drug plan that includes families, high co-payments or deductibles, or needing a drug that's not listed as a benefit. Recently, some policy researchers have proposed a national pharmaceutical plan and have even argued that this may save money by using purchasing power to make drug companies lower their prices. It's important to recognize that a national drug plan won't solve the problems regarding access to necessary drugs if the national formulary doesn't cover the drugs that children need. Regardless of where the plan exists and whether it's publicly or privately financed, we must continue to advocate for affordable medications to treat pediatric conditions, especially chronic ones. Keeping children healthy is the best way to prevent illness in the adult years. Thank you.